Right. I'm switching back to the PPT. Right. So we are going to talk about the laws of radiation. So these are laws which all waves of the electromagnetic spectrum are going to follow. Okay, they have a practical application whenever we use any modality, and you have to remember that whatever laws we are thinking of over here, or whatever laws we are studying over here, they will be followed. They all the electromagnetic spectrum waves or frequencies will follow all these laws. Okay, so you have to keep that in mind, and you have to think accordingly, because this is a theoretical concept, but when you see the machine, you should be able to translate your theoretical concept into a practical application. Okay, that is what we will be expecting from you when you start looking at these different modalities and the machines. Okay, so the first law of radiation, which is what you've been doing, I don't know, since you were in the 5th, 6th, and before that ideally you should have been doing this at home. Hello, was that an
Yes,
echo?
ma'am. No, ma'am.
Was that an echo?
No, ma'am.
Okay, so this is something that you've already been exposed to. You have been seeing reflections since maybe you were babies, and you will have first learned to identify yourself based on your reflection. So, what do we mean by reflection? We have got something known as a ground, okay, or a surface. So, this dark line over here represents the surface. When we think of any radiation, we have to think of the normal. Can you see this dotted line over here, this very faint dotted line over here, which is perpendicular to the
Yes,
surface,
ma'am.
right? So this is known as the normal. The normal is always perpendicular to the surface which it is being considered against. Okay, so when we talk of reflection, I think all of you know this. The angle of reflection is equal to the angle of the incident ray, which it makes with the normal. Okay, we are not talking of with the surface, we are talking of with the normal. So we are looking at a ray which is striking the surface at a particular angle. If it is getting reflected from the surface, it is going to get reflected at an equal angle. Everyone knows this law, right?
Yes, ma'am.
Yes.
Okay. Now, do you remember the list of equipment that we saw the last time with the EMS, electromagnetic spectrum lecture?
Yes, ma'am.
Yes, ma'am.
Right. So if
Yes,
we are
ma'am.
speaking of reflection, which of those equipment will actually follow this law? Any idea?
The low
Any idea?
frequency, the low
Sorry?
frequency modalities,
Sorry?
low frequency modalities,
Okay, low frequency modalities. Can someone name a low frequency modality?
Electrical muscle stimulator.
That is the name of the device. We are looking at the
Then
modality over here.
the Federic current and the galvanic
Faradic
currents.
current, galvanic current. More than this, what can probably use or have reflection as an application? We have to consider waves. So when we say waves, what are we looking for?
high frequency,
Yes, high frequency.
there are short wave diathermy and long wave
Therapeutic
diathermy.
ultrasound.
Shortwave diathermy, very good. Yes, then
Ma'am, therapeutic
UVR,
ultrasound.
very good. Ultraviolet radiation. Someone said something and I have just cut that person off. Who said? Someone said UVR and after that someone said something.
Ma'am, I hate Goel. I said therapeutic ultrasound.
Excellent. Even therapeutic ultrasound is going to use reflection. So we are going to look at anything that creates a wave, okay, or anything that has radiation in its name. Any idea of these equipment? Other than ultraviolet radiation, what else has radiation in its name?
Laser, X-rays.
Infrared radiation.
Infrared laser, very good. Okay, so anything which creates a wave is going to be using this law of reflection. Okay, the issue with low frequency currents is that they are targeted modalities. Okay, so over there the reflection is minimal as compared to high frequency radiation, high frequency modalities, or your proper radiations. Okay, so we are concerned about attenuation in low frequency currents, but the fact is that their penetration itself in the tissues is very less. Okay, and when they are penetrating, they are directly going to stimulate nerves. So we are not really, the effect of reflection refraction over there is minimal, but when we are looking at high frequency currents or high frequency modalities like SWD and ultrasound, the reflection does play a major role over there. Okay, fine. And with radiation, so laser, infrared radiation and ultraviolet radiation, you are going to get a lot of impact of the law of reflection on these modalities. Okay, so everyone has understood where we are going to think of applying reflection.
Yes, ma'am.
Yes, ma'am.
Right. So when you look at that modality, when we start the theoretical component of this modality, you will be thinking, or you will be correlating the laws of radiation over there. Okay. And when you start the practical aspect, you will be applying the laws of radiation to that modality. Okay, so I want you to start integrating material from different lectures. Okay, so this is the law of reflection. We move on to the law of refraction. Again, you have a surface, you have a normal, okay, and whenever you have an incident ray, depending on the density of the other material, this surface, this black line, is going to divide one medium from the other medium. Okay, so depending on the densities of these two media, you are going to get refraction of the wave, which means that the angulation between the refracted wave, refracted ray and the normal is going to vary depending on the density of the medium. If the medium is rarer than the first medium, then what will happen to the refracted ray? Will it move farther away or closer to the normal? This is 10th, 11th and 12th physics. Oi, wait. People, are you there?
Mama, to move closer to the normal. Denser it
When the
moves.
air, when the medium is denser than the second, than the primary medium, this part where you can see the black arrow, that medium is denser than the region where you can see the blue arrow. What will happen to this?
Ma'am, tend towards normal.
Yes, it is going to move
Away.
towards the normal. The black arrow, that region is denser than this. What will happen? The second medium is rarer, which means that the molecules are spaced far apart. What will happen to that?
The
It will
blue arrow will go away
say,
from the normal.
I'm sorry, I didn't catch that.
The blue arrow will go away from the normal.
Yes, if the medium, the second medium, so here I am talking of the medium in which your blue arrow is. if that second medium is rarer than the first medium, which means that particles in the second medium are spaced farther apart from each other, they are going to move, the refracted ray is going to move away from the normal. And if the medium is denser, which means that the particles are closer together as compared to the first medium, then the refracted ray will move towards the normal. Have you seen a glass of water, and if you stick a spoon in it, what happens? हे तुमचं झालं असेल ना?
We see a bent spoon.
You see a bent spoon, right? So that is because of the refracted rays that you are seeing. Now what happens in the body is you are going to get a refraction of the waves, radiation, ultrasound waves. You're going to get a refraction of these waves whenever they hit different structures in the body. Okay? Keep that in mind. Okay? So whenever you are thinking of applying all these modalities, you'll have to consider that there is going to be some amount of energy loss because of reflection and refraction. Okay? Got this?
Okay, ma'am.
Yes.
Right? The third law is something new over here. So we have the cosine law. This is the surface and your normal. What our cosine law states is that whenever any ray is perpendicular to the surface, okay, the angulation between the normal and the incident ray is 0 degrees, maximum penetration occurs. Okay, cos 0 is, cos 90 is, cos 0 is,
1.
cos 90 is 0, cos 0 is 1, correct?
Yes, ma'am.
Yes.
Yes,
Right?
cos 0.
So we are following
Yes,
that law over
ma'am.
here. काय झालं? कोणाचा तरी आवाज खूपच हलतोय when that person is talking to me. Anyways, so that is the law that is being followed over here. If the ray, incident ray, so you start applying a modality, and if you ensure that that modality is exactly perpendicular to the tissue, to the skin surface, you're going to ensure that maximum penetration occurs. Okay, so most of the rays are going to go into the tissues that they are targeted at. Okay, which also means that if you have an angulation to your modality, you are not going to get an efficient use of that modality. Okay, everyone understood this?
Yes,
Yes,
ma'am.
ma'am.
Understood? Now,
Yes.
with this in mind, if I place the modality such that it is parallel to the tissues, okay, what is going to happen? All your rays, can you see this cursor? All your rays are going to pass along the surface. Nothing is going to go into the surface, right? We don't want such a situation. So you have to ensure that the modality is placed exactly perpendicular according to cosine law. Okay, fine.
Yes, ma'am.
After this, we have got the inverse square law. Everyone is able to see this picture? You've got S,
Yes.
the blue circle, that is your point source of emission of radiation. Okay, this law is very simple to understand. The the closer you are to the point source of radiation, the more intensity of the radiation will be felt. Okay, and the farther you get away from the from the source of radiation, the lesser is the intensity that will be felt. Okay, now how is the relationship between these two? So the distance and the intensity of the radiation are inversely proportional to each other. Okay, fine. How so? The closer you are, so if we are considering R as the distance between the point source and the intensity, okay, intensity is going to be proportional to R square, the square of the distance between the point source and the area, the surface where we are giving that radiation. Okay, understood this? Intensity
Yes, ma'am.
of the radiation which is going to be felt is going to vary according to the square of the distance from the point source. Okay, everyone okay with this?
Yes, ma'am.
Right?
Yes.
So can you see this? At R you have one square over here. Okay, so intensity is maximum over here. Okay, when you come to 2R, the intensity has reduced. Okay, the amount of energy that is reaching 2R has reduced. Can you appreciate that? Lesser number of those red spots, right? So intensity has reduced based on the square of the distance from the point source. Okay, square of 2 is 4. Okay, hence you can see these 4 squares over here. The farther you move away from the point source to 3R, intensity has reduced even more. Okay, there is a vast reduction in the intensity dependent upon the square of the distance from the point source. Okay, 3 threes are 9. You can see 9 squares over here, which means that the intensity, the radiation is falling over a much larger area, but the energy that is being supplied is very less. Everyone clear with this?
Yes, ma'am.
Understood this concept? Okay.
Yes.
So your intensity is going to vary according to the square of the distance between the point source and the surface. Okay, the distance that the rays travel. Okay, this is again very important when you are thinking of radiation modalities. Okay, am I, are you getting how it is going to be important? No, you'll
Yes,
have to
ma'am.
see the modality before you say, yes, I have understood this. You'll need to see the modality. Okay, I'll give you an example. Uh, you have used, if you are sitting in a room, okay, and you have got a tube in one corner of the room, which is on and which is giving light. Does it reach the whole of the room? If the tube is in one corner, yes, no?
The intensity will be less, ma'am, in the farthest corner.
Yes, you will, if you are supposed to read a book in the farthest corner, will you be able to read a book? No, because you will not have enough light to read against. Okay, so you have to think in those terms. If I am away from a point source of radiation, how much intensity am I getting? So it is very less if I am farther away from the point source. As I go more closer, it is going to be more. ओके, ह्याचा अर्थ हा नाही की जी काही मोडॅलिटी असेल त्याला तुम्ही जाऊन चिकटाल बरं का, प्लीज ते लक्षात ठेवा. We have got heat modalities which are going to use the inverse square law, and we have a set distance beyond which we will be keeping the patient. Okay, so please don't apply the inverse square law in this manner. You have to ensure that the person gets enough heat, so you can adjust the distance between the point source, which is your lamp, and the patient, so that that person gets enough heat. आणि हीट नाही होते म्हणून त्याला जवळजवळ घ्यायचं नाही. ओके, मग त्याला सांगायचं आम्ही तुमच्यासाठी दुसरी मोडॅलिटी वापरू. ओके, फाईन विथ दिस?
Yes, ma'am.
Yes,
Yes, ma'am.
ma'am.
Okay. Then we are going to move on to the next law, which I think all of you are very, very, very familiar with. Current is equal to voltage upon resistance. So current is directly proportional to voltage, inversely proportional to